How to urinate with your Studer pouch. Sit on the toilet and gently bear down. You may need to bend forward at the waist in order to start the stream of urine. You may have to press on your abdomen above the pubic bone in order to start the stream of urine. Can I reuse my catheter? The reusing of intermittent catheters may increase the chance of you getting a urinary tract infection. Therefore, it is not recommended. Activity. Lifting should be limited to 10 pounds for the first 6 weeks. This includes small children, pets, groceries. Wearing light compression wrap is highly recommended to prevent hernia. Take naps during the day to make up for lack of sleep, as you may be getting up at night to void and catheterize. Start walking every day. Slowly increase back to your pre-surgery activity level. The goal is to return to pre-level by 2 months after your surgery. Diet. We recommend that you eat a soft diet for the first few weeks to allow your bowels to heal. Gradually add in foods until you return to a normal diet. Some foods can change the color and smell of your urine. Example, eggs, fish, asparagus, spicy foods, beets, and vitamins. Drink 8 to 10 glasses of liquid per day. Example, water, juice, broth. If you have kidney or heart disease, your doctor may want to decrease the amount of fluid you drink per day. Sexual activity. Talk to your doctor about when it is safe to have sex. Generally, it is recommended you wait until after your incision is healed. This usually takes 6 to 8 weeks. During the surgery, nerve for sexual activity could be affected. Nerve-sparing procedures may or may not be done. Please have a discussion with your surgeon. Men. The surgeon usually removes the prostate and seminal vesicles during the surgery. If your prostate has been removed, you will experience a dry orgasm. Some men are unable to have an erection, however, they may still experience an orgasm. Consult your surgeon. Women. The surgeon may remove the uterus, ovaries, fallopian tubes, cervix, and sometimes part of the vagina. You may experience pain or difficulty with sexual intercourse due to the narrowing or shortening of your vagina. If you have not gone through menopause, this operation will start menopause if your ovaries and/or uterus is removed. Just because the vagina is smaller does not mean you cannot have orgasms. Travel. In time, you will return to your regular lifestyle and the possibility of travel. When traveling, ensure that you have enough supplies with you. Carry twice the amount of catheters you normally would in case you need to catheterize more frequently. Ensure all medical supplies are kept in your carry-on luggage. Prior to travel, it's a good idea to check where you may be able to get supplies if needed. A list of supplies you use is helpful in case you are hospitalized for any reason. Consider getting a medical alert bracelet indicating that you have a Studer pouch. What if there is an increase in the frequency of leakage? This is normal. The newly constructed Studer pouch is small and therefore more likely to leak urine. Don't be discouraged if you're leaking. Follow the guideline, timetable, and void often. In other words, void by the clock whether you feel like voiding or not. You may increase the frequency to void. For example, if the routine is to void every 2 hours during the day, try to void every 90 minutes instead. The best way is to set an alarm on your phone or watch. Do not decrease the amount of fluid you take as it may thicken up or increase the amount of mucus in your Studer pouch. Is it normal to leak urine during the nighttime? This is normal. Most people achieve daytime urine control well before nighttime continence. Don't get discouraged. If your residuals are high, or if you're very bothered by leakage, Set your alarm clock 3 to 4 hours after bedtime to wake up and void. There may be times when you have been on a routine schedule for days or weeks, and then suddenly you find you have to schedule void more often. This is common. This may be because the stooler pouch is adjusting its size, or you may have an infection. See signs and symptoms of infection. What if I am unable to fully empty my stooler pouch? This is normal. It takes time, practice, and patience to know when the stooler pouch is fully empty. Your position, standing or sitting, can affect this too. Try other positions to find what works best for you. Gentle pressure with your hands on your abdomen may help drain the stooler pouch. What if the intermittent catheter is not draining anything from my stooler pouch? Once inserted, pulling the catheter partly out and in may help fully drain the stooler pouch. If the stooler pouch is not fully drained, it fills up faster. While your stooler pouch is new, urinate and catheterize on a schedule. If you're having issues flushing out mucus, increase the size of the catheter. Larger number indicates larger size of the catheter.